Okay, well, welcome everybody. We have quorum, so we can actually have a meeting today. We can do things. Great. So, get the meeting started. Everyone wants to look at the last meeting where we had a quorum. You were able to review the minutes that's from August. I don't know if anybody has any changes they'd like to make or motion to approve the.
I would move approval.
Okay.
I would vote the August 27th
Yeah, I was like,
and October 22nd.
October meeting, but the yeah. Yeah.
I move approval of both sets of minutes.
Do we have a, okay, that's. And.
Hello, everyone.
Hi, Jeffrey.
Hi, Jeffrey.
Hello.
Okay, so if everyone's in favor, then agenda minutes are approved. Then we're moving on to 2025 meeting planning.
Dr. Peters, point of order, me that I was abstaining.
Okay.
And a question about our committee members, because that's not shown that on the attendance sheet. So was there any?
I was on that.
Oh, you are?
I was on that.
Oh, I'm just looking at the attendance for 2024, and she's not listed on.
Because so I had withdrawn from the. And I'm just now re-engaged, so I probably won't be on it until the next.
Okay, all right.
Okay, that's good to know too, because I don't really know rules for probably.
Yeah, if I hadn't withdrawn, then I would have been consistent with that.
Okay.
Then I would have been.
Okay.
Okay, for clarifying that. And I think moving forward, so we have as members, Dr. Patterson, Jeffrey Lord, Dominique, myself, Trish Powell, Ross Silvers, Kiara Lovett, and Esther.
That's the next.
Okay,
I was informed that Trish Collins has withdrawn from the committee. So Ross told me that yesterday.
okay.
And she is taken off of my roster for next month.
I'm just trying to clarify, Madam Chair, what number of members we have, so.
You know, absolutely, thank you for that.
A forum.
Okay, so the attendance, the member attendance we have there, Trish would be taken off, and then Esther would be added, and then that would be.
Yeah, so 7 voting members: Patterson, Jeffrey Lord, Chris Jones, Dominique Randall, Ross Silvers, Kiara Lovett, and Esther Matthews. And quorum is.
And I do kind of remember Esther isn't a voting member yet because she has to attend to.
Oh,
And that, I think that's the rules, isn't it?
I have to go back and look at.
yeah.
Well, I think I'm a voting member, just because I'm a board.
Okay.
Yeah. I guess.
Let's go with that then.
Yeah.
Board members out of the 7.
Yeah,
Okay. All right, thanks for.
okay, yeah, and here for us, okay. So we can move forward with 2025 meeting planning. So. Eric, you want to?
Well, we had the CoC board meeting recently, and there was a lot of lively discussion. Teresa and Esther could probably talk the most about, speak to that more than anyone, and well, you were there as well. But the name change occurred. The board voted for the Systems Disparity Inequity Taskforce.
Yes, Systems Disparity and Equity Taskforce. Because we started talking about how if Donnie weren't there, if hard to do some of the work too without having providers involved in this committee. And some of the discussion was around providers, you know, the name, the DEI committee name, maybe not being good for some of the providers being able to be involved, so. This was the name that was proposed, it's the Disparity Inequity Taskforce, and hoping that that means we'll get some providers to engage now. Because that's gonna be really important for the work, so and important to the providers being on the committee.
And just to add a couple of points, one was related to the term DEI, being sort of attributed because of some of the funding that comes from the state to providers and their reluctance. It's actually the state that the contract prohibits them from addressing DEI, the contracts they have in the state, which is disturbing. And so I don't know that the changing, this is just my opinion, I don't know that the changing of the name, the name is one thing, but the intent of the organization remains pretty much the same to address disparity in our provision of services through the home with CoC. I don't know how much anybody watches politics. National politics, I probably watch it way more than I should, because it's not healthy, but there are efforts to take what's happened in the state of Florida to a national as well. So, and it concerns me that, the funding from the national level may change. There's still not a Secretary of Housing and Urban Development. It's just a lot of things that are happening that may impact everything as we move forward. My final comment is that I think at some point that maybe someone should go to the joint meetings of the Providers and Funders Council. I think that they meet periodically. I don't think they meet, I think they meet separately and maybe snapping up. But there are times when they meet collectively. And the reason I'm suggesting that someone go to those meetings, as a funder, I imagine you might attend the Funders Council or Karen for that. So I think it needs to be spoken about in the joint Funders and Providers Council. And the reason I think that is because I know as a former representative of a funder in the city of St. Petersburg, and I've been a reviewer on funding from other agencies, organizations like Pinellas County, Pinellas Community Foundation. They specifically asked about in their applications about how agencies are addressing things that fall in the DEI category, such as what's the composition of their boards, racial, ethnic, gender, etc. They asked do they have affirmative action or equal opportunity policies. They asked do they have policies that address disabilities, etc. All those things fall under diversity, equity, and inclusion. And I understand providers being concerned about revenue to operate their organizations. But I'm wondering how they can address those, just to satisfy all masters, so to speak. So, but I think this is a serious matter and that some discussion probably should be had with the providers and funders to encourage them or to discuss it. You know, how are y'all addressing this and to try to encourage some involvement from the providers? Because I think that right now you basically got funders at the table here, both the foundation as well as Pinellas County. I'm a private citizen, Esther's a private citizen, or I don't know, certain if you're representing NWPA, but it's something that I think that it's serious, and I don't know how many folks had an opportunity, and I don't know if I'm ahead of it talking about the racial disparities study that was done, but we've got to address these issues, and I'm wondering if changing name is going to accomplish getting providers involved. So I hope that can say, that's the bottom line, we're gonna get them involved, and if they're not involved, that, I still think we're spinning on wheels.
Yeah.
If we can't do part of the intent or recommendations, well, just the study itself documented that there are providers that our residents feel are not treating them appropriately, and it's based on a number of factors, some of which are racial, ethnic, or gender issues. So, I don't like to beat a dead horse, but I see this, it's something.
No, it's about.
Consider my recommendation, and someone, I don't know if it's a cadre of us, you know, I don't necessarily wanna put it on Susie, our chair. But I think, you know, both Esther and I are board members, you know, I'm willing to go, I'm not certain when they meet anymore, but that would be my recommendation.
Yeah, I think that's a great idea.
And I was gonna say, Susan, when you first did the study or the tool, you know, we built out the toolkit, I remember the conversation saying, until there's real teeth put into the accountability of it,
Yeah.
then they're not going to do anything, they're gonna check the box and keep it moving. And I also remember conversations about points being, decreased or increased based on the intentionality behind it. And until, Michelle really stands up in that space, I think we're just kicking the can down the road. Now, what I do think with the shifting of the title of this committee, Sam is over the systems committee and the data can come down. It's very clear that there are inequalities in the system as it relates to pockets of genres and populations that we serve. This committee can be very intentional with that work based on the data that comes down the pipeline, and we can move it forward, I think, a little further with true distinct intention, without it being called the Diversity, Equity, Inclusivity Committee. Because yes, providers are shining away because the climate, political climate is simply what it is. And many of them are under attack. We've had meetings that have clearly said they've had to shift because they're specifically being targeted. But what is not being targeted is system disparity. What's not being targeted is the data. So this allows us to be more, which is why I was happy about the meeting.
I think we're gonna have to also continue to monitor political atmosphere because, you know, depending on how things are done under the new administration, there may be funding that's going away anyway, you know, just because. But in the meantime, we have issues in this particular state related to the public camping and that kind of thing that I'm not certain. We just gotta continue to monitor because it may be that as well, meaning as we intend to be about trying to make sure that homelessness is not criminalized, it may very well become that. So.
I'm gonna add one more comment. So what's the why and the how? I think that we need to be very clear on what it is that we're trying to accomplish, why we need to accomplish it, and how we're gonna go about it. That's what we need to take back to the job and have to get there complete unanimous knowledge to move forward.
So we know that there are disparities in the system. I don't know if it would start with us or I mean me. I've talked to Sam a little bit about updating some of the data or just getting some more updated numbers that we can then maybe go to do some outreach with the provider council and outreach. Like I would also go like help maybe present some of that, like maybe get something together to do that. Talk about the name change, talk about the importance, like understanding, you know, the barriers that exist for our providers, but maybe that's a start. And then it is true, like that's also what I've been thinking too about without the real teeth behind you know, we have the toolkit, we have like, this is what you can do, but just like putting it out there without doing any accountability checks. I don't want to say like anyone's doing anything wrong purposely, but it's without any check-ins or anything like that. I don't know, where we are spending our.
And we got into consequences.
And yeah, this is quick too, so it's like, okay, and
Because
we hope you're doing this, you know, yeah.
and I don't know, maybe staff does, related to when we put in, when I say we, the continuum of care, when they apply to HUD for the funding, is there, is there information, I'm not participating in reviewing review. You did. Are there questions in there about addressing disparity in our system?
So I was very, and I put a voice to this, I was very disappointed in how it was posed in the review tool. It was, did this organization state that they do this? And then you go and you look at their submittal, and it's just a yes or no. And then if it's yes, then you come back to your tool or your review tool and say, yes, they did, and then it tabulates. To me, I'm gonna say, yes, I did, if I'm looking for fun.
Sure, but how you verify?
But then how do we verify it? And it's only the known relationship with the organization that would say to someone, well, I know, but I know they really not, but then there's really no way to. That's a,
And another thing is, the post monitoring for the project that we're awarded, that's something, but, and also with that scoring tool, which could be definitely reviewed again. I will say that most projects did not receive points for the racial equity. The portion, yeah, most of them did not receive. So it does, it did significantly lower a lot of projects, and that was another side of contention in some with some people as well. So.
And I know, again, I can only refer to my own experience that with the city of St. Petersburg, we did include not only the question, but asked them to provide like a listing of their board members, their race, their ethnicity, term of service, a number of different things to sort of figure out how they're really addressing it. And I know at one point there was an effort to try and get the local funders to sort of align their applications to be similar. Do you remember when Susan Hill sold was with the HLA, and I know that the Funders Council, City of Largo and Arrow and all those folks, we did compare our applications, and a lot of them were very similar. But I'm wondering if if HUD also thinks us. I'd like to hear, if possible, from Jeffrey. I know that he receives HUD funding to address discrimination in housing for Pinellas County. I know there were changes made in the former president's first term to do away with the permanently. I can't get it. It's about impediments of fair housing. Jeffrey, can you talk any about how HUD is addressing trying to affirmatively further fair housing now or lately?
Yeah, I'm not sure that I have the what I want to say access to be able to speak on it, but I do know that charge is still out there for the counties and those folks who receive federal funding from HUD to continue in efforts to affirmatively further fair housing. I'm just not in those meetings. I'm privy to those meetings.
I appreciate hearing that. So, but the reason I asked that question is because HUD encourages fair housing. I mean, there's been a Fair Housing Act since
1968.
Thank you.
1968. Mm-hmm.
Thank you. And that's another piece of addressing the disparity that we see in our system. is that I'm wondering, we know, this anecdotally, that there are folks that go out to apply for housing, and we know that, I don't know how many cases that Jeffrey received in complaint of discrimination. But we know folks that the body of folks that we deal with for the most part, one have issues, both out to make it simple. We know that Americans don't take housing choice back. And the folks that receive those housing choice vouchers, oftentimes the same folks that are, we're still seeing in our data, that are primarily those that are homeless. And that in itself will solely say that they're being discriminated against, but that's one of the indicators, I think, of how the disparity exists in our system. Because we got landlords that won't pay them, or if you've been evicted so many times, they won't rent to you. We know that if you look at the data from those that receive eviction notices, we know that that's people of color. I mean, it's just it is. We were talking about the name change, that's why
So, quiet, because I feel like I say the same thing over and over again every month, but how many times do we get that? Okay, I'm listening. I'm just gonna be quiet this time, but, as someone who did not go to the board of directors meeting and knew that this was gonna be brought up, I felt very out of the loop of the evolution of the name change. I was putting my eye on the agenda packet didn't come out till I actually emailed saying, hey, I heard the committee had been expanded. So there's people there's people that are supposed to be in this committee that aren't here today, who are also not aware of the name change. And again, it's just kind of that, I'm trying to avoid that, trying to avoid the same conversation. So just having that high level like awareness and communication of like what our intent is and what we're trying to do. I want us to go back advocate with funders and providers. I want us to do all of those things, but we can't do it until we know what we're doing, because I've got multiple participants to join this committee, and this committee, as we know what's happened, has continued to just be stagnant and irrelevant. So I'm not in the area of like, I'm not in a space where I even want to like champion this committee, because we're not ready to do it again yet, in my frank opinion. The checkbox was 3-4 years ago and was supposed to evolve into more points. And that's been addressed multiple times, the thing with the name change that has been addressed. Like it took 6 months to, I think, plus that we've been talking about name change. So like, I just don't know what else to do. And like, we're a task force now. What is HOA? How does HOA define a task force? That's different than a committee. So, or is that just task force as the name, but we're still in the committee? Like, I don't know what's going on.
So, all right, so admittedly, I suggested the name change, and I'll tell you. Ms. T and I had this conversation yesterday. When the DEI committee was first formed, I was working the same business department, and Sheila Lopez is the one that brought me to it to take her space. I felt like at that time, there was excitement, we were meeting it 2-on-1, we were moving along. When I left, when I was forced out of things at the fall, I lost touch, but I remembered the committee and I wanted to get back and re-engage. But when I came back to re-engage now as a business, it was a very different committee that I re-engaged with, and I did not feel the excitement. I didn't feel the commitment. I felt like Dr. Reed was begging people to be a part, and that's when Dr. Susie came and the study was done and the toolkit was done, but it was still begging people to come and not a working committee. Then I became the chair, I felt the same thing, which is why I disconnected. I feel like, especially with the political climate, people are shying away, not because of the work, but because of the name. And I feel like it doesn't matter the name, the work can still remain intentional. But the work can remain intentional with the data. And that's the piece that I feel we've been missing. We haven't been getting the data to now give us the charge to move forward with the work. And with HLA already having a system committee, that should be a direct pipeline. And I know that we were very clear in our board meeting that Sam and Susie should be talking based on the data that Sam's committee is pushing down. Then Susie's bringing it to this committee, and then that's our charge to move forward with the purposes. We have to know what, the why, and the how we're going to be. I don't think with the task force title, we didn't lose teeth as a committee. I just think that for me, when I hear task force, we are very clearly driven by the work. And we're moving forward. That's how I think of it. And I don't think I added task force. I think it was July or April.
Somebody, but you know, task force usually implies temporary.
Yeah, that's the thing that we're gonna have. I think aging, it's the task force implies a different type of committee and temporary, as we said. If we're going with that it is leaning towards the DSP data, then we need to move the frequency of this meeting, because the DSP doesn't meet till Thursday, I'm in that committee. And so we would be a whole month behind the data that is being reviewed by DSP. So if we're gonna really lean into that, then we need to move this.
I'm all right with it, because I think that data drives the work. And so data needs to be how we move forward.
And it's gonna be a whole month, whatever, it's DSP, and we'll look from there, you know, what has to go to provider, what has to go to board. It takes 4 or 5 months to get something through if we keep it with the current.
Well, you know, the one thing that I sort of miss from having attended board meetings, even when I wasn't part of the board, and that was long before it changed to HLA and CoC being separate, is that the data used to come to the board meetings graphically and be discussed during the course of the board meeting. I don't see that happening. I mean, we had a board meeting and Sam did the report.
He just does verbal, and I don't.
Right, it never used to be that way. It used to be that staff, Brian that used to be over. Brian and or Susan Finlod, so they would go, or Avery, I think, would go through, would actually have it on the screen what the data was, and we'd go through the various charts to talk about those entering the system and the services they access and the numbers exiting the system. We don't do that anymore. I think that, you know, again, what Dominic says, that the data will come out and we'll have to look at it after the fact. I don't think anybody actually sees the data anymore. And that's the shortcoming, I think, of the system, that we don't, right, other than when we had the presentation about what the pit was, and that, in my opinion, was disastrous at the board meeting, because I didn't trust the data that the consultant provided, and he couldn't really explain it. Were you there when that was done?
What was wrong with it?
I'm sorry.
What was wrong, or what did you know?
Well, we even went so far as to say some of the titles, like for youth, it was just the way he presented it. I think it was pushed together quickly, and he could not really. I think he's a new consultant, but we used to have another. Was it Ray somebody?
Oh, you had Ray Santalucia, right?
I'm sorry.
Was it Ray Santalucia who used to do that?
Yes, yeah, used to do it, but there was some new person now.
That's right.
he could not really answer the question.
I was only going with it quickly unravel.
And so, but my point is that the only data we seem to currently review now is stuff from the fifth. We know that's just one data. It's not the ongoing data that comes from HMIS. And so I think that's a shortcoming for us as a system. We're not looking at our data, but we're just having a board member give us a summary report. I think that we're lacking in that respect, and if it's not happening at the board level, I'm not certain that what kind of data we're gonna get here at this level for us. I'm not even certain who's over them. There's a new staff member that's, I don't know who actually does.
For DSP, for data system performance.
Yes,
So Imani is still, there's a transition happening. I started about 3 months ago, and so I will be
okay,
doing that.
I'm
Yes. No, it's fine. I still wear the new lady and here, it's a transition that's happening, but that has been, HMIS has been assisting with that for being the liaison for that meeting, Sam as chair, for quite a while. There was no one. For well over a year.
yeah. Do you know Avery? Sorry.
I have met her once, and I'm gonna be meeting her again this Friday, to get some background there. Be good.
And you may even mention her, those times that we reported it, just be. That sounds to be helpful, but any, I think we over.
Yes, and some of those were recorded at our. There's also, the dashboard, on the website. That's essentially what we could see. So it's there, how early it is, reviewed. DSP looks at it, but I don't know where else. And there is gaps, and I was looking at it, because it really wasn't very much to see data, this was a different lens, DSP was looking at versus. Or the,
And since you're part of that committee, does the data reflect races and all this other stuff that we're.
the ongoing, things with minors, and it's working with homes, because it's the.
So it is demonstrated that there's still, there's some progress.
So one thing we be very specific with the thing that we want to see as a community, like, we don't have to just say, Sam, give us what he will review it, we can, okay, I think that. Yeah, we need the data on this, and what we are, I don't want to just, that's the one.
And I think it should be driven by, based on findings from the disparity. The fact that,
See what progress that
the men are 32% in American.
But this is a question, but clarifying point, that study was done 4 years ago.
Yeah.
Before the pandemic.
So very,
Dates of March 2021.
Yeah, that's what I was under the impression, because I was just,
I don't know, I'm
sorry, we're doing that, we're in that.
So very different issues. Like just in the space of 3 months, our community was very different. So I would think like, yeah, driving by that, but the data set points are very different that we should be people reporting.
We have to identify what those things. Or then, I mean, I still think that there are things from that study that I'm imagining have probably only gotten worse.
Yeah, that's my imagination.
Yeah. And family, like I could have told you that too, like I'm not going to told this before. I wonder if that's worth it. Not.
And for me, the question has always been, even when we first presented this to, I remember, I think you presented it by Zoom. So we know this, and how are the providers addressing it?
Yeah.
That's always been my question. How are they working, and how do we provide their recommendations of how they should be addressed. You know, as I recall, there were examples of staff not interacting like they should with folks of particular races. I don't know how you deal with that if agencies don't have policies that prohibit.
Because that's what it comes down to, is changing policies, practice, I mean, one of the things, but starting with policies, practices, and procedures.
Jeffrey does have a plan.
Yeah, thank you. Well, the conversation is really good in the room. What I'm hearing a lot of questions and inquiries, but very few solutions. And it's been said many times already this morning that it should be data driven, but we don't know who's collecting the data, where it's at, how they're reporting out. And the question that I have is, do providers ever meet with the board or some other committee related and have to report out directly to that board the things that they're doing along these D&I issues? Are there meetings like that to take place? Because I mean, they could even meet with us, and we could have a list of questions that we ask providers, and then we provide that data to the board that we've met with providers, and this is what they're saying they're doing. Because I don't know that they're self-reporting or that they're asking deep enough questions. As I heard that it was just a check a box kind of situation. So I don't know. I'm asking the question because we've got to do something. And I know some folks might think some people are being alarmist when it comes to the future political climate, but I can tell you, last time when our former president was president and he put Ben Carson over HUD, it was a disaster. And the affirmatively furthering fair housing went away under that administration. So it's real. Thank you.
And in the meantime, the people suffer. These are real people. So the name change is fine. We can calculate a lot of different directions.
But I think to Dominique's point, I didn't, that makes the cadence of getting data too. When would this committee have to meet then in order for it to make more sense?
I think honestly, that's probably a question for you and HMIS to have a understanding on. I mean, the DSP packet, I think it's already been sent out, right? Like, we got that one, good. And we're taking, for at least the first month or two, or quarter, whatever, we could probably just look at their data and see what we would be important on that and move forward. Would be my suggestion. And then we can start talking for more specific about data, moving forward. Or we can also ask DSP to, what have you guys already identified or seen and have that be?
I reached out to Sam. I'm gonna set up a meeting with him, hopefully before our next meeting, so I can report out on what we discussed too. But it definitely sounds like we have to identify first, like what are the data points, but I don't know. I'm removed from that right now.
I also have reached out to HLA, to inquire about the scholarships that I have been hearing about, because I've been a part of it. Because there are several younger voices that do want to get involved, but I do think the CoC would be a hindrance, because there's one important thing in the scope of what I need to pay than to be a part of this. And so I'm waiting to get true clarity on what those scholarship amounts are. And I think once I get that, we'll have bring younger voices.
And that's individual membership, $50 a year. But have there always been scholarships?
I just know that every time I talk about, the membership, I'm always told, even in board meetings, no, we have scholarships.
It's only been the past like 2 to 3 years, it's been very challenging for me to connect people, so I don't do it.
So with that, I'm gonna put, so I'm telling you, like,
2 years into the group when my person go on. Again, I'm gonna have to be angry today. I'm gonna be frustrated with it.
there are people that would dive into this. When we keep tapping into this is what I know in NAACP, continue consistently tapping into the same people to say, come to more meetings, that's when we don't get it. But bringing some fresh people to the table, that we don't create a burden for them, but they're fired up to do the work, will not only bring fresh ideas, but it will also eliminate the hardship on many of us who are in a million meetings. So, they keep saying scholarship, Steve, and I promise I'm gonna bring them on. They're gonna tell you what money is.
But no, yeah, there's some out there.
And I hope it's not a lot of red tape to do it, but then I'll talk and should not red tape.
That's a good question. Who is is there an interim CEO for HLA?
No, we have, board chair, Nick.
Yeah,
He's not the interim CEO, but he is kind of external and internal, and we have Cindy Cutler.
I'm saying, that it's been there a long time. And the reason I said, question is because I think there has been a brain drain, and I don't mean that folks are not, no. The intellectual property has walked out the door, and so the staff probably does not know where the money may be budgeted for scholarship. And I think that's pretty legitimate. I mean, I don't know how efficient the record keeping process is at the HLA, who serves as the lead agency for the CoC. Is there not?
I hope our board chair, Sean, because they're the ones that I've heard.
You saying Sean? Sean King. The thing is, though, being a policymaker, a board member, I doubt that he knows in a working, I've been on the board and I don't recall seeing a budget coming to me for approval. Am I wrong on that? Maybe I was asleep during that meeting.
I believe the money for the scholarship, I believe it's basically the private donation, it's not like a funding source.
Okay, but I guess what I'm getting at is, I serve a lot of boards. Okay. With the split of the two agencies, HLA being the lead agency for the CoC, we're not board members for the HLA. So I don't know if y'all board looks at the budget and approves it over time, annually or not. I don't know. I think I came on the CoC board in January, if you recall on that, but anyways, during the time I've been on there, this is now the 11th month, I haven't seen any kind of budget that we had come before the board for approval at all. So it's just an odd configuration for me. I mean, that we have no idea. That's the question numerous times. We have no idea where if there's money in the budget that came from a sponsor, and whoever it came from for scholarship. Like, just an odd.
I just know the climate is changing, the community is changing, we need new voices at the table.
Oh, I agree with you wholeheartedly, but I'm just saying, should be an easy question to be answered. And, you know, as the most organizations say, oh, we keep it in whatever line item, and yes, we can. I mean, our folks that are good experience for members, I believe that they're given a stipend for attendance. And so that's in a line item of the CoC budget.
Comes from membership.
Okay, so that's a good answer. So I'm wondering if that's where funding for scholarships, but also in that, I don't know. That's a bit easy.
I'm thinking to myself, Victoria's on vacation this week, and I totally, they know it all. She really, this is her, that would be her, we will follow up to find out.
Thank you.
Need three, that's all I gotta say. Dr. D has two.
Well, the only other thing I would say is that there is some kind of screening process for when people want to join the organization. And I say that without naming the person, but I know there was someone that wanted to join, and I can't remember if the board or to be a member. And I think they declined the membership. I'm not on the record.
Oh, I heard that.
But I'm just saying, that that's an example of, they want to sort of like vet to say whether it would support.
It's 9:46 now, like, we talked about the committee name change, kind of talked about meeting dates in terms of probably have to do a review of if we're going to be really intentional about using data to drive decisions changing and figuring out when these meetings have to be. So that would be,
So does the DSP, meet the third Thursdays on hearing?
Third Thursdays, I don't know. So it's a very busy week.
oh,
It's right here.
So would it be appropriate then to make ours the fourth Tuesday? Next question a week, or?
When it's,
That's on
the board meeting is first Friday.
Right.
Board meetings first Friday of the month. And that next meeting will be January.
That's the dance of that I'm talking about, right? So if you have something the fourth Tuesday and then board meeting the first Monday, you could not get it in the packet, potentially every other month. So it's almost like the DSP should move to say, I don't know what there is second. Funders is typically the first, is that the one that's second Friday, every other combined? I don't have the, there used to be a really pretty like, annual calendar with all the meetings. Yeah, so that you can see that dance of like, how much time.
Yeah, funders providers right now is a little in flux as well, so I don't have a group dates for that yet. Right here. Yes, typically, funders, providers meetings are Fridays. Yeah. Your providers meetings will, Friday, the third. Is the second Friday.
so these are all action items under number 3, right? So I just want to be clear on review of committee name change. Do we need to say like we're voting to accept that name change as a committee?
Only thing I'm stuck on is that task force. Are we a task force or are we a committee with task force? And then will that be confusing for somebody joining or interested? We don't have to follow, I can tell you. We don't have to look for the task force, they'll be done.
Well,
Here.
the only thing I would say is that the board voted on that name change, so I know that.
Yeah, the public do we
I think that, I think that is actually, that motion was made and passed, and we're getting quorum issue, the quorum question, and how that's made, and attendance, that's committee.
But are we a committee with task force?
Task force.
Or task force?
Well, it's just, that's the name, I would send that.
So we're all for task force.
We are committee with task force. Yeah. In the board, I mean, there was no discussion about the shifting of what this committee is doing, how it stands up. And how it's forward facing for the organization. It was just a name change. It wasn't a duty or, criteria. I don't think in any committee, yes, the board voted, but the committee can absolutely go back with a suggested amendment. And Teresa, you and I can bring that forward. I don't see why that would be an issue. So if it's the task force name, you can go back and say, the committee is coming back with a friendly amendment to something that was voted. Can we change the name to Business Disparity and Inequity Committee? I mean, that's.
I thought that you made the motion to do
I mean, I made a motion to change the name, so I agree.
that.
So, we're gonna go back with it.
Okay. So we're sticking with, if system disparity and equity task force, what we're saying in the committee,
No.
No, System Disparity and Equity Committee.
and equity committee, okay.
So are we, so this is the thing that I had in my mind that I wanted to bring forward today. What I've noticed in the board meetings is we're doing verbal updates, but we're not coming with this is what we did in our meeting. So are we coming with something in writing to the next board meeting? And of those things in writing, these are one of our action items that we're bringing forward.
That would be, committee workflow updates. There's this new format in the very, very back of the packet, that a committee had created and recommended the board, and so that's being rolled out to all the committees. And it's just a summary of highlights and what the motions and actions were made, and then also, decisions and items to discuss. So basically, this is a good way to, if there was something that this committee decided they wanted to send off to the DSP committee, this is a good way to keep it instead of having pages and pages of minutes that no one is on.
We did that with the new committee that's just formed, the advocacy committee. We had a task force that built that out, and now the advocacy committee is going to be using that, and I think that we should be using it, all of we should. Because this is what we present to the board in the package, so that they walk in the door and know this is what we're bringing forward. So I think that this name should be, one of those, our conversation about, how we're looking at data. The what, the why, the how. These are the things that we've been discussing, so they know that we're moving with intention and this.
And that's wonderful. I think some of the reason it hasn't happened is because we have not been able to achieve a quorum.
Yeah.
To take things out. So, good, that we have a quorum. Never going on.
So we're making motions on
She made a motion,
it? Okay,
I seconded it
okay, great,
about the name change.
okay.
Madam Chair, I would suggest we move on to quorum requirements, because that's gonna be another discussion.
Yeah, and I don't have much more time than 10, and it's 9:34, so let's at least get to that. And we can talk about it.
So during the board meeting, I don't know if it's for me to speak. During the board meeting, they took some action to, because they had been having challenges as well for achieving a quorum. And so they took action to allow for those that are participating virtually to also be able to, be considered in attendance for quorum purposes, and to not just be listening or observers. They can now vote, and y'all correct me if I'm wrong on that, for the board meetings. So they set this issue because they knew we were having challenges with reaching forums at this committee. They thought we should consider, or at least discuss whether we want to change to the same practice of allowing those that are virtual to also be considered as a part of the forum, as well as be able to be more than just observers. Is that accurate?
Yeah, I remember that discussion as well. So I don't know if somebody wants to make a motion on that or want to discuss that.
I'm not gonna make a motion. Cause I'm one of those that doesn't, I don't like other meetings, so I don't think that, I'm one of them, I'm not gonna make the motion.
All right, I'll move forward. I do think it's important for all voices to have a voice, for all voices to have a vote. And so I do want to move the motion forward that, we align ourselves with what the board is doing, allowing for a quorum to be met, in a hybrid.
And the only other, oh, you mean,
I can second that, so we get into discussion.
yeah. During discussion, I'd like to mention, and I believe that it was mentioned in the board meeting that I believe the provider or that they alternate. Wasn't there some discussion in the meeting that they have some meeting, one meeting is virtual, the other is
They do two in one.
person, I'm
They
sorry.
do two in one, they do two virtual, one in person. So now,
Three virtual.
Okay, so most of their meetings are virtual meetings anyway.
They have decided for their joint meeting. Now, the independent meetings, they meet twice a year under the providers. I'm not sure, because we haven't met yet. With the intent to borrow that.
And so, you heard me say earlier, I really don't like these hybrid meetings, but so, I won't be supporting this where you can have some people in person and some virtual. I think that there is a lack of participation for those that are solely gonna participate virtually, unless drawn into the meeting. Did they asking some questions or monitoring the chat? When you're in hybrid meeting, I find that somebody's gotta be charged with monitoring the chat and questions and comments that come in the chat and how we integrate that into the regular meeting. So my preference is always in person, but I would suggest that if we go to this, what's being recommended by the motion, I would suggest most people are going to be participating virtual.
how many meetings does the, sorry, the monthly, so it's monthly, so theoretically, could we do, did all right, if I like the training, then we'll start my training, I'll have to adjust my whole thing. So where we do, make it where we do, once a quarter in person. Which would make it 4 in-person meetings in a year.
And would that be mandatory or you still allow?
Mandatory, and then the rest would be virtual. So here's how I look at all this, right? And I don't know what that is like number wise, so if y'all can help me out. The definition of insanity is doing the same thing and expecting different results. We are not meeting forward by making it a mandate to meet in person. And so we're gonna either keep kicking the can down the road, and eventually I won't be here. Or other people as well, right? If we put it connected. Or we make an adjustment and see if it works. So if we did 4 virtual, 4 in person, and the rest virtual, what would that do for the monthly?
If we do January, February, March virtual, roll in person. May, June, July, virtual, August, virtual. September, October, doing,
It's the every 3, I'm sorry.
I can't do that. It's not. January, February, virtual, March.
Like that, and then the rest of it. Yeah, like that. So I like to make it for. Yeah. And then we need to make a mandate, the mandate that can be more.
Yeah, what?
cameras need to be on. So that is the most, all those days with the mandated cameras on, and we're virtual.
Yeah, February, May, August, November. Yeah. And then virtual, Amazon.
And if your camera's not on, you're not counted as being present.
But I agree with having cameras on, people do.
Would you like me to read them out?
Yes.
For in-person meetings a year, February, May, August, and November, and the rest virtual with the stipulation cameras need to be
Yeah, all in favor?
Just for that question.
Yeah.
So, if I understand the motion, there would be 4 meetings that would be in person. In order for us to have a quorum, we have to have 51% of the membership be in person. And then all other meetings would be virtual.
So 51% is 4,
It
correct?
is currently 4.
And for virtual meetings, the quorum requirement is that.
Yeah.
It's just the same in regard.
Yeah.
Thank you.
And
Public,
so everyone in favor? Okay. Motion passes. But we're still figuring out dates, it seems like. Like, we're still figuring out if we're gonna be,
Yeah, because we're, based on what.
because we gotta figure out that, but in terms of like quorum and where, how we meet, yeah, where. How we meet.
Jeffrey, do you have any comments related to what we just did?
Yeah, I'm really agnostic. I mean, I try to attend physically, except whenever not possible. I if you think that kind of rule change will encourage more participation, I'm not sure that it will. But if you all feel like it might, um, then I'm not opposed to it. I'll put it that way. Um, Particularly, I'm just not a big fan of mandating. Folk have to turn their cameras on in order for us. Just because we see them physically, we're assuming they're participating in the meeting. I don't know. Seems a bit much for me, but I'll I'll support whatever the majority of the board says.
We're gonna go with that. That was what was approved.
Let me say one more thing if I can, if you can hear me okay. The audio quality in this forum, in this room, is not good. It's spotty at best, and those who have strong voices come over really clear, and those who have less strong voices, you really struggle to hear them. So I don't know that this is um, a good way to garner participation if the audio isn't real good.
But that's also the argument for not being hybrid, I think, too. I think if we're all virtual or all in person, we won't have those kinds of issues, so.
Yeah,
I think that's a reason why hybrid is probably not gonna be a great option to have.
yeah, yeah.
That is one of the ongoing hybrid issues.
Yeah. Yeah, and I really get frustrated and struggle with hybrid meetings and that's one of the reasons.
Because there's an echo in that room, it's kind of a void, and so there's an echo that comes over too.
Yeah, that's fair. All right, so we are moving on then to committee workflow updates. And I don't know, I know it's kind of fine, I just want to point that out, so I don't know that people time.
Got maybe 5 more minutes, I have to start.
Okay.
provider.
So with that, might be a little, do we need to motion, or do we want to motion to table somebody until next time? Like, we do that? I don't know.
I would suggest we do,
Okay,
and I would encourage folks, I not keep pushing about the disparity study. I know that Megan sent it out late yesterday afternoon. And I heard folks that they've not read it, to read it. I also, have suggested to Megan that the board needs to get a copy of this.
All of you.
I appreciate that. Again, we have a lot of new board members since 2020. And, I think that they have no clue when I keep harping on them, they have no clue what was even in it, so I think it should be considered.
And I think it'd be really interesting, there was quite a few interviews done.
I did like 35 interviews.
And I will see where. And I know some of them.
And we'll just wait to hear from Sam about when our next meeting is.
So do we have a motion to, adjourn that?
Well, we're going to do this, this table, and I'm going to do the most for the table number, 4 and number 5. Until our next meeting.
And so the only question I have is our next meeting in December?
I think our next meeting should be the new virtual that we decided on. And then hopefully we can make the calendar change for 2025 at that point.
Which will be December 17th, that'll be a virtual meeting.
Yeah.
Okay, thank you.
And at the next meeting, we can approve the date.
And then, I will not be at ESP this week because that's also the street outreach meeting is happening. We can prioritize that. So you'll be there though. And I will ask Sam as well to consider reviewing the dates.
Now, can you send us a new calendar invite for the December one right now? I can't edit it.
This, fundraising template does not need to be approved by the committee, but this is just, we wanted to say this is what going forward.
We covered it. Yeah.
Okay.
Thank you.
Thank you.
First meeting. Then we're coming back.
Yes, thank you for coming.